And good afternoon, good morning, wherever you are. Might even be tomorrow for our international people. I am Dr. Jerry Dreessen, and the Executive Director here at the Association of PEMF Professionals. And I want to welcome you to our Thursday Live. And feel free to jump into the comment area and post if you are watching us live. And today we are going to be talking about PEMF and FDA approval. And some of you already know this. Some of you are just learning about this. Some of you are just seeing this broadcast for the first time and like, what is PEMF? And the FDA is like already approved some of these things. So I want to jump down just a tiny little rabbit hole. Feel free to do your own research as well. It's pretty easy. It's out there as far as what the FDA did with PEMF. So with that, let's just jump right into it. And let me change out my screen size. I'm going to shrink and it's going to go big. There we go. So as far as FDA and PEMF, the FDA approved PEMF therapy for multiple uses decades ago, and verifying that it is a legitimate and safe form of physical therapy. It's also not just for humans, it can be used on animals as well. So that's the scrapings of Google to talk about it. But that's just Google saying that. So we need to get it from the horse's mouth, which is what I want to do here today. So there are a couple of things that it was approved for. One of them is the bladder, so bladder incontinence. And this National Institute of Health article talks about the affecting the cellular interactions with microvascular. And so again, in the bladder, you have this system, and you can like go online and pull up the bladder and do an anatomy search on that. But basically what happens is the bladder comes through and there's a tube that is the ultimate exit, and there's a muscle that is supposed to close up called the sphincter, and it's got its own blood and nerve supply. Sometimes that doesn't work and it stays open, or it stays closed and it doesn't open, and you got to put a little system in there that opens it up. But the incontinence comes from that system not functioning well. So it's like and it's not striated muscle like your muscles in your arms. It's a type of smooth muscle which has a different anatomy setup. But PEMF will penetrate, it'll go in deep, and it'll start activating the pelvic floor and getting those muscles to start working again. And it does that through the cellular interactions in microvascular settings. If you can imagine a capillary, which is the end of an artery as it goes all the way through, it's small, about a little bit smaller than a human hair, but it only allows one blood cell to go through at a time. So it's a stack. That's micro, and that's what they're talking about as far as microvascular. And that's the system that feeds the tissue. And without that, then that tissue no longer functions like it's supposed to. And that's one of the great things that PEMF does, is it helps with that. It helps open up those channels better so that there's better flow and you can rejuvenate tissue. And so that's one of the things that I've used it for. And there are a lot of people that have, at any age, they can have bladder issues, especially, moms having babies, and just, all of a sudden they've lost some of their ability. But this system goes back in and helps turn it back on for some people. It's not 100%, but if you have a, PEMF device and you want to help with that, then there's lots of information you can go out and grab. The next one that I like too is wound healing. And so in the wound healing world, We've got from the Food and Drug Administration itself, we've got their product classification and the uh, the device peripheral electromagnetic field to aid wound healing. And so there's some reviews going on there, but again, approval. So wound healing is, again, opening up the channels for microvascular and also nerves go to blood vessels, blood vessels go to nerves. So you have that communication system. And if you can reestablish that, then you can start turning on literally turning on the electrical system that harnesses these. And so you can create faster wound healing. And those of you that have followed me on these broadcasts know that I would love to see PEMF units inside of burn victim places where it'll help the burn victims' tissue heal faster so that they have a large success rate of not only survival but less scarring and being able to take on the grafts, the skin grafts. If you can imagine doing skin grafting and PEMF to allow that system to heal better, stronger, faster, that would be any of you that are out there that are thinking about a business that would or a company to approach, that would be a really good one to knock on the door of. So we have this already out there. FDA says, yep, we approve this. We know that it does this. The next one that I want to talk about are bones. And so now we're talking about being used as a safe and effective treatment for non-unions of bone. The great thing about this is it goes over the cast. There isn't anything out there other than PEMF that'll actually heal fractured bone outside of the cast. There isn't anything. And that's the great property about PEMF, is that it travels through everything, whereas everything else has to make contact. And so you can help regenerate bone through some sort of electrical stimulation. Inside the bone, as far as the anatomy, there are two, well, there's more, but there are two main cells. One's called the osteoclast, and one's called an osteoblast. And the osteoclast goes in and chews up bone, and the osteoblast lays down bone. And so you got this system where your bone is always reorganizing itself. As long as you're getting D3, so sunlight, as long as you are compressing the area, so you're creating a piezoelectric effect in the bone, so it'll help the system, that you're weight bearing, and that you are feeding your bone with all of the nutrients that it needs. If you're doing that, you're going to have healthy bones throughout your life. And some people talk about how their grandma fell and broke her hip. It's usually the other way. They break their hip and then they fall as a result of that, because of the osteoporosis that goes on. So again, if you can just take your PEMF device and put it on both sides of the hips and turn it on, you can get the neck of the femur to be stronger. Again, the person that's getting the PEMF, it's going to be the nutrients that they consume and the exercise that they get. But if somebody has a bad leg or knee or something like that, and they can't walk, they can't get into the pool, so PEMF would be a perfect system for them. So bone healing over the cast, on top of the cast, sprains and strains, anything where there's a hairline fracture. If you can, again, speed up the healing, it can take anywhere from 8 to 17 weeks for something to heal based on how bad it is. I have a patient currently, and they have a break in their vertebra, and they can't see somebody till October as far as getting it looked at. And that doesn't make any sense. And he's on a workman's comp claim, so you can see how frustrated he is. But we started using the PEMF on his back, and I tell him, I said, look, your L&I insurance is not going to pay for this. It's not approved yet for payment by insurance, so it's going to be out of pocket. And he goes, I don't care. He goes, I'm able to walk now because of this. And he goes, this is my favorite machine. And so he's coming in every day, doing anywhere from 10 to 20 minutes of PEMF on his fifth lumbar where the fracture is. And he's now walking around probably 80% less pain. He was just barely walking. A young guy, he's in his late 20s. And so in his mind, it's like, okay, how am I going to live the rest of my life now with this problem? And now it's not only helping him out, but it's giving him hope that he can actually win from this injury that he didn't ask for. But, you know, when we saw it on the x-rays, like, oh my God, you broke your back and you can't cast it. So again, PEMF is perfect for it because it's going to stimulate the growth of these cells and start knitting together. So I'm hoping that I'm hoping that by the time he actually gets out there and is seen by somebody, that this will have started knitting itself together. And they're like, you don't have a problem. And you'll show them the x-ray with a fracture, and then they'll take theirs and it won't be there. They'll go, how did that happen? So I'm waiting for that event to happen. That'll be very interesting. So the next one, and I think this is a big one, and that is how PEMF not only fights depression, but PTSD. And there are so many people that are surviving head injuries, whether it was from a car accident, whiplash, sports injury. You know, there's a even, you know, with the vets, they've got the black 22. They've got a black ring that they wear because every 22 minutes a vet is committing suicide because of depression. And that's what they're all about, is, you know, trying to control that and prevent that. And again, we saw earlier, there was a slide, see if I can pull it back up here, where it is affecting cellular interactions at the and microvascular. So now here we have a device that can be placed over the head that goes through the bone that helps with vascularization of the brain. And some of these areas have been damaged, and that's why there's depression, and that's why there's mood changes, or forgetfulness, being able to think straight, or short-term memory, long-term memory losses, you know, forming the right words, forgetting, you know, where you are, like, what was I doing just a second ago? PEMF will help with that. And if you are a member, you can go into our members area, and there are 2 interviews that I've done with Dr. Toy, who's up in Quebec. In fact, he was live on our PEMF con that we did. And this is what he does. He's got a, I don't want to say apartment, but he has a business with rooms. And that's what he does. I think he's got 5 rooms. And so he can do 5 different people, and the people stay there. They live there. Their families come with them, and they're for 3 or 4 weeks getting constant PEMF care. And it's been able to change a lot of lives, a lot of people that were depressed or had, you know, PTSD. I have patients that are in car accidents and they injure their brain through hitting the steering wheel, or it's a side lash, or they get hit so hard that the brain is like jello in a bowl and it sloshes back and forth, and it gets injured just from that. And then they're afraid to drive. They can't sit in a car anymore, or when they do, their anxiety goes up. Or they relive the accident, or they dream about the accident, or always getting hurt. So there's this brain issue that happens, and getting them on a PEMF over the head, helping with that, definitely changes things. I have a chiropractor who got hit in the side, and his head hit the window, and the brain got a small tumor in it from that. And it was shown on MRI. So we, you know, have been setting it up on that. And he knew that he couldn't think right. He goes, there's something wrong with my brain. And everybody's like, nah, you're fine. So he paid out of his pocket for an MRI. And sure enough, there was a little micro tumor in there. So we started doing PEMF, and that pulled him out of his, you know, thoughts, you know, of he was depressed, but also there were things that he couldn't remember. And he knew that he couldn't remember. And so once we started doing this, then his whole system turned back on again. And to be a part of those is awesome. Now, as far as being able to say that this is what happened in the world of research, it has to be double blind. There's a whole lot of protocol that has to go in place in order to have these trials and these things that I'm doing to be published. So unfortunately, they can't because there's too much possibility of bias going on. So again, if you're a person that loves research, if you're if you're a CPA and you do PEMF, it's probably something that would work for you. But again, as we go through FDA, it's probably one of the best things that you can put on your posters, on your cards, on your website. Did you know that the FDA has approved these things? And so, and they use the word medical, which is a keyword which helps us out. But again, it can also hurt us if we say medical, because now you're practicing medicine without a license. So it's medical PEMF therapy. But what that just means is it's been, looked at, diagnosed. So you can work with a medical provider and work that, but you don't have to say that medical PEMF therapy, in my opinion, because PEMF therapy sessions are the same as treatments. It just depends on who's holding on to it when it's being delivered. But it's been accepted in many countries. The US FDA accepted the use of PEMF devices in the healing of non-union bone fractures, urinary incontinence, muscle stem, and depression and anxiety. So 1979, 1998, 2006. So it's been around for a long time with approval. And that's what I wanted to walk through today. That was the big secret, which really isn't a secret. That's something that, in my opinion, should be shouted from the rooftops. So if you have a rooftop and a good ladder, hop on up there and let people know that these are the things that you're doing. This is what you can help with. Who do you know? And again, you can walk into professionals that treat these problems and say, it's been FDA approved that this device that I use helps with depression. And if you'd like to create an alliance where I come in and I set up once a week or twice a week or 3 times a week for an hour, and give me your worst clients, your worst patients, and let me do like a 30-minute session on them, and and let them see. And it's safe and effective. It's like, well, putting PEMF on the head, it's safe and effective. It's been proven. It's been around. And the fact that if it hadn't been, it would have been recalled a long time ago. So don't worry about if it's safe and effective, because you can pull out the FDA articles. In fact, if you're out shopping to do in a strategic alliance with a healthcare provider, have this in a little 3-ring binder that you can hand them. This is me. This is what I do. Here's what FDA says. If you'd like me to come in and do a trial, and that's what you hand out. You can do some door knocking and handing things out to the different professionals. So, chiropractors, again, people that treat wounds, people that treat burns, incontinence, so pelvic floor, workers, and then also fractures in bone. So, that's usually urgent care, but there's going to be like the follow-up care, going in, making sure things are healing properly. So again, if you can have those communications, dropping things off, start knocking on doors, you can build your business up, even if you're in a small town. If you can have strategic alliances with the healthcare professionals, that'll definitely help you out there. So that's my tip for the week. If you liked what you saw today, please like and share what you see. We've got Facebook, we got Instagram, LinkedIn, YouTube. In fact, right now I'm broadcasting live on all of those systems, and you can go in and if you have a LinkedIn account, go to our Association of PEMF Professionals side and click like and share on each of these. If you can do that and help spread the word, we're growing. We're continuing to grow, and we love the fact that we are getting more and more of your responses to help us grow. We've got a private members only group now. And if you are a member of the AOPP, you can hop in there, and we've got some special things going on. And we can do some, in-depth discussion on certain topics. And as always, on our website, you've got our code of ethics, and this is who we are and what we're all about and why we stand out. And what we're here to help anybody that's got a PEMF device. We're here to help you out, and that's we're um, uh, a multi PEMF device international organization to help you learn and promote your business as well. So. With that, I want to take just a quick second here to jump in there. Deborah Jones, thank you. Yes, we love it too. That was our goal way back in the day when we started this out. And Kathy, hey Kathy. If you didn't know this, I went to high school with Kathy, so it's kind of cool when we get to run into each other and say hi. So thank you again so much for all of you that have spent time with us and spending time with me this morning going through this. And again, if you are not a member, if you're interested, on our website, PEMFprofessionals.com, there is a process to go through to click and become a member. If you have any information that you want to share or questions about us, again, info@PEMFprofessionals.com. Drop us a note. We're always interested to hear back from everybody, whether you're a member or not. And with that, again, I want to thank you so much for spending time with me today. And I look forward to seeing you again next week on our next Thursday Live. So take care, and we will see you in a week. Bye.